According to the American Diabetes Association, an estimated 1.4 million people will be diagnosed with diabetes just this year. And in most of those cases, it could have been prevented. Diabetes is a chronic, lifelong disease marked by high levels of sugar in the blood. Today, we will explore the three main types of diabetes: type 1, type 2, and gestational. Have you or someone you know been diagnosed with diabetes? Then this is the show for you. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Damon Tanton is the medical director of the Advent Health Diabetes Institute and Florida Diabetes and Endocrine Centers. Now, he's here to get our conversation started about all things diabetes. Welcome, doctor.
Well, thanks for having me.
We've all heard diabetes, but how would you define it for someone who said, what is diabetes?
Well, the first thing to decide is, are you talking about type 1 or type 2? The vast majority of patients have type 2 diabetes, right? So type 2 would be what you would find later in life, usually after a few years of gaining weight and maybe having some problems with sugar. Finally, you're diagnosed with type 2 diabetes. Type 1 diabetes is what you traditionally hear of with children, or kind of random cases. All of a sudden they're in the hospital for diabetes.
Okay, so it sounds like one can be more lifestyle and the other is more genetic. Is that an oversimplification?
Maybe. Both are genetic.
Mm-hmm.
The type 1 diabetes is something that really is not under your control at all.
Okay.
Random. Type 2 is genetic plus, and that plus is maybe some of the lifestyle things, but I don't want to say it's just lifestyle because there are a lot of genetic underpinnings.
But how would you define diabetes itself? What is not working in the body where you would say you're diabetic?
So type 2 diabetes is a process that begins, say, 10, 15, 20 years before you get the diagnosis. And that's the problem. But that's also a good thing because you can anticipate and maybe even prevent or postpone the process, right? So we develop insulin resistance. So the body doesn't deal well with insulin. That's called insulin resistance. Mm-hmm. That starts very early, and that's the precursor for type 2 diabetes.
So if that's off kilter, what's the danger if our insulin levels are too high?
Right, because the insulin levels really are what dictate the disease. So when the insulin levels are starting to rise, way before the sugar rises, mm-hmm. you start to develop things like increased body fat, especially in the middle. Mm-hmm. Maybe feeling like you're low sugar, hypoglycemia.
Is that you would notice that by the energy or lack thereof?
Absolutely.
Okay.
The most common effect that people see is the belly fat, right?
People who are apples,
yeah,
thick around the middle as opposed to a pear.
Right. So I tell people, if you didn't have access to any labs, the best barometer of your metabolic health is your amount of abdominal fat.
Okay.
So belly fat, when you start to look in the mirror and you're not sucking it in, and the belly fat starts to increase, that's a sign that you're starting to develop some insulin resistance.
Okay. Let's talk about the numbers we hear on the commercials for all of these medications. A1C, what is that?
A1C is a 3-month average of all sugar.
Okay.
So the problem with A1C is that it's not going to rise until the very last part of the spectrum. So you could be insulin resistant for 15 years, become majorly overweight in the middle, and the A1C be normal, because the insulin in the background is keeping the sugar normal.
So you have to be aware of all the numbers, not just one.
I do not rely on A1C to determine whether someone is pre-diabetic. Now, it can help. If A1C is high, then we say, yeah, you're on your way to diabetes or you already have diabetes. But I look at the physical features of the patient, and then we often check actually the insulin level, not just the sugar, but the insulin level, because that tells us how hard the body is working to keep the sugar down.
Got you. Can all of this be reversed?
It can.
How?
It can, as long as the pancreas still works. So when you have elevated levels of insulin, that means your pancreas is cranking out tons of insulin. As long as the pancreas can do that, you could reverse it.
Okay.
Once your pancreas burns out and is no longer able to make the insulin to keep the sugar low, there's not a lot that we can do to move it backwards.
So is that the case where you have to take insulin every day,
That's right.
either orally or you have to give yourself shots?
Yeah, so that's what we call, a pancreas that burns out. The only thing that can truly keep the sugar normal is external insulin. We don't ever want to get there. And fortunately, with type 2 diabetes or insulin resistance, it's like a hurricane. You can see it coming from a long way off, right? You can decide whether you want to do something about it, but it's coming. And that's what I think the biggest message today is: don't wait until a diagnosis of diabetes, because in some ways that's too late.
Okay.
You need to really look for the signs. The signs for insulin resistance are all around us, and the main one that everybody focuses on is central fat. If the belly is starting to get bigger, make sure you're screened for diabetes.
So are you hopeful about reversing the trend as you learn more about this
I'm
disease?
hopeful if we get more focused on early detection, early screening, and early intervention. And I think the biggest mistake we make is we wait until we have a diagnosis of diabetes type 2. That should never be a surprise.
Okay.
It should be something that you see a long way coming off and you take steps to get in front of it.
Well, we've got more information that we're armed with to have those conversations with our physicians.
Yeah.
Thank you so much for being here.
Well, sure.
We'll be back with more. We're not done. The goal of Advent Health's Thrive Diabetes Care Program is to motivate people to effectively manage their diabetes to help them feel whole. With us to explain more about the program is Laura Stack, the Outpatient Program Manager. Thanks, Laura. I love the name of this program, Thrive, because a lot of times people will hear a diagnosis and start thinking about the ways their life is changing for the worse, or how it will never be the same. So tell us what the Thrive program is and what it does for people.
Yes, so Thrive is a free voluntary program, and it is designed to help support you manage your diabetes. You do have to have a diagnosis of type 1 or type 2 diabetes, and you can have the Cigna health insurance plan with Orange County government, or it's okay if you don't, you're still eligible to enroll.
So I thought it was interesting when you said family members are involved too, because once there's a diagnosis, it doesn't just impact the person who's been diagnosed. Now everybody has to be more aware. So what kinds of things are you teaching people in Thrive?
Yes, absolutely. So we know that the family portion is a very important aspect, especially having that support at home, not just at the Diabetes Institute. So we offer lifestyle education there, and we have dietitians that patients can meet with, and they can bring, a +1 if they want to bring a spouse or a family member to discuss all things nutrition related. We also have nurses that you could talk to about, blood sugar readings, or if you have questions about your medications and things like that, so they can really go one-on-one with you and take that time to review it. We have exercise specialists. So some people, their goal is to lose weight or they want to build muscle. So they can meet with our exercise specialist one-on-one. And we'll work with you wherever you are, depending on your goals. There's behavioral therapy. So we have behavioral therapists who can talk to our patients about stress management, relationships, emotional eating, or really any behavior that can get in the way of your health.
So this is like a one-stop, you have no excuse kind of program. So what's one of the first things that happens when someone says, okay, I'm going to check this out?
Yes, so participants can reach out to the Thrive program either via email or by calling, and we'll confirm their eligibility, and then we'll want to get them set up with an orientation. And so that orientation is about 30 minutes to an hour, and we would review the program with them, have them sign a consent, and then we can get them enrolled in the program and start meeting with their appointments as early as the following week.
Okay.
So,
do people come solo and with their families, or do you find some people just want to come with their support group or team?
Yeah, so we see both. Some people, they might go and they're very motivated and they don't have their family with them, but then others, they prefer to have that additional support. But we do in-person appointments or virtual, so depending on how you want to attend those appointments, you can always have one other person with you.
I was fascinated when you talked about the behavioral piece. Tell me some of the things that happen there. Is it just getting people to accept this is where I am in my health journey, or is it the people say, well, I can eat this sometimes, can I?
That's a great point, and it's something that we often don't think about, how powerful that can really be, but it really is just a one-on-one appointment, kind of like our talk today, where you could talk to a therapist about, maybe difficulty with your diagnosis, if you're finding it hard to accept the diagnosis, or even it's just hard to manage your stress and your workload with having diabetes and trying to manage everything on your plate. So depending on what that behavioral issue is, we're here to help and work with you on that.
Have you found that it's often just as difficult for the family members to go through this? What kinds of things have you heard or do you provide for them?
Yeah, so for the family members, it can be a lot as well, especially for someone that has type 1 diabetes, where that's a little bit more involved. But even with type 2, it changes kind of the whole perspective on eating and your lifestyle. So it's nice to kind of keep an open line of communication where the family can always join in the appointments, but it's something that we really focus on the individual and then expand outward.
So what I'm hearing is if someone needs solo or team support, you've got everything under the Thrive umbrella.
Yes.
Thank you so much, Laura.
You're very welcome.
And we will be back right after this. Stay with us. Is being discovered about diabetes, both type 1 and type 2, and how to help you live a healthy life no matter which one you or someone you care about is dealing with. We hope you got some tips that you could use, and as always, talk to your healthcare professional. We're always here to help you make healthy connections.